And in that form, we just ask them how high is the probability for developing shortness of breath or swallowing problems, and how do you think these patients will survive? And then I did it for the computer. I think it should be incorporated in daily clinical practice. I think it's a useful tool for doctors.
Yeah, it just seems slightly surprising to me that in a way technology isn't used more in these cases. Why is that, do you think? Do you think doctors have just been reluctant to use computers?
Yeah, I think they are indeed a bit reluctant, because a lot of doctors are convinced that if they see a patient, then they know how to decide for this specific individual patient.
You're not, of course, saying that there is no role, no job for doctors to do anymore. Presumably, these computer models will be complementary to the work that doctors do.
Yeah, absolutely, absolutely. We don't want to replace doctor because he has a lot of experience generally, and you can also see it as a very specific lifeline, something like that. I wouldn't want to be a patient with only sitting in a room with a computer who's telling me how the treatment will go. So no, certainly not.
Is it cost effective?
The computer is a relatively cheap option, and for instance, now 100 patients come into the clinic, and only 10 of them maybe have shortness of breath due to the radiotherapy. So if you can identify those 10 patients, you could do something with your treatment. For instance, give proton treatment. It's too expensive to give all patients this new kind of treatment. But if we can select very accurately the patients that would benefit the most of it, that would certainly be of great value and also will be cost effective, I think.